I'm Fergal Monsell. I'm an orthopaedic surgeon working in Bristol, which is in South. The question is, what brought me to CSC? And the answer is simple. One of my colleagues, Jim Aird, is working here as a surgeon, has been for the last 6 months. Cases here that you could do, and what about coming over? So I went, okay. One of the causes, particularly one of the first cases I operated on, was someone who'd been bitten by a snake. We don't have too much of that in the UK, but the effect is muscle shortening, and the effect on the limb is equivalent to a bunch of other things that we would see. So the principles are the same. The severity is much, much more marked here for a variety of cultural, economic and other reasons. The two things that stick in my mind are the extreme presentations of conditions which I don't normally see, and then the, for me, unusual positions of things that we would sort out in a much more straight. That's my impression of CSC. It's a very positive impression. I've worked in places that are pretending to be similar, and I think that it's very well organised. It is a very efficient system. It's not necessarily the system that I'd be allowed to use in the United Kingdom. People have different demands. The patients would have different demands, which would make it difficult for us to have perhaps the rapid turnover. For instance, when I say efficient, it means I see a patient and then an hour later I'm operating. The equipment is good. It's not as plentiful as I'm used to in the West, but that's more of an indictment on what we do in the West than what happens in Cambodia. What I've learned is that you don't need anything like the fancy boxes of gadgets that we use at home, and if you think about things a little bit more carefully, you get away with using simple tools to do exactly the same. I've had a great time. I've enjoyed it hugely. I've met people I hope I'll meet again on a number of occasions. I hope I'll be allowed to come back. I'm certainly able to come back, but I'm allowed to is another matter. I've had a great week.